Welcome back. Our ability to drive innovation for preparedness and response, as you've heard this morning, depends on collaborations with our private sector partners. Our next speaker leads the team that makes those collaborations happen. He will be providing an overview of how to engage with us and the many funding opportunities that we support here in BARDA. Please welcome to the stage BARDA's Director of Contract Management and Acquisitions, Mr. Geoffrey Benford.
All right. Good morning. I am Geoffrey Benford. I have the honor to serve as the Director of Contract Management and Acquisition Division here at BARDA. Every day, my team works diligently to cultivate partnerships between BARDA and you, our valued private sector collaborators. Together, we've made substantial strides over the past year. A year ago, during BARDA Industry Day, we listened, and we listened well. We listened to your feedback. The new opportunities and streamlined procedures we're sharing with you today reflect what we've heard from our partners, you. Today, I am thrilled to present information on some fresh ideas, fresh opportunities, and ways to strengthen our partnership. In the next few minutes, we'll provide an overview of the main points for our private sector collaboration. Our mission is to develop medical countermeasures that address the public health and medical consequences of chemical, biological, radiological, and nuclear CBRN accidents, incidents, and attacks, pandemic influenza, and emergent infectious diseases. We do this by driving innovation, creating partnership opportunities. My group supports this by making it easier for you, private sector collaborators, to work with us. We offer 4 distinct entry options which can be likened to our primary access points. The first is our recently revamped broad agency announcement and easy broad agency announcement, which you all have heard quite a bit about today. Second is focusing on the efficiencies related to our broad agency announcements. And third is our innovative rapid response partnership vehicle, as mentioned earlier in earlier presentations, which fosters collaboration for swift responses to future emergencies. Our fourth is TechWatch. This is our program that facilitates engagement between private sector partners and BARDA, as well as other government entities, prior to submission for formal proposals. As our director, Dr. Gary Disbrow, mentioned earlier, we've had a busy yet productive year that ended September 30th. In FY 2023, we've completed 722 actions, surpassing $5.75 billion. Notably, we've exceeded FY 22 by $1.3 billion. These actions span from 750,000 to upwards of $1 billion. This achievement reflects strong collaboration with many private sector partners. It also reflects the successful transition of contracts previously issued in collaboration with the Department of Defense. This was completed by the end of July, 2 months ahead of schedule. The ability to work efficiently like this and streamline your interactions with BARDA is what sets us apart from other government organizations. We are premier. Congress has given BARDA unique authorities that enable us to engage with and support our collaborators across the private sector. We are different from NIH, which provides grants that support basic and clinical research. Our focus is on advanced research and development and to foster and grow the community of innovators like you working to fortify the nation's health security. We do this primarily by soliciting proposals and awarding contracts to our partners for specific work that advances our strategic goals. Some of our funding is from Project BioShield, which supports late-stage development and procurement and makes countermeasures needed to protect the U.S. population against CBRN threats available. Many of our projects solicit proposals via BARDA's Broad Agency Announcement, better known as the BAA, supports advanced research and development of medical countermeasures across threat areas, chemical, biological, radiological, and nuclear incidents, pandemic influenza, and emergent and infectious diseases. The BAA is the point of entry for the majority of BARDA contracts. In September, we published a new revamped broad agency announcement designed to accelerate partnerships, improve responsiveness, and meet expanding demands to develop medical countermeasures. The BAA process lets us shorten the timeline between submission, market research abstracts, and formal proposals. It enables us to issue awards faster than any typical government RFP. There are currently 12 active areas of interest in the broad agency announcement. These areas of interest are not only innovative ideas, but they cut across chemical, biological, radiological, and nuclear countermeasures, influenza, emerging infectious diseases, diagnostics, MU chip, COVID-19 MU assay development, implementation, and flexible and strategic therapeutics, what we call FastX. Although the BAA is very flexible, there are limitations around construction, large-scale production, and follow-on work. Next, we have what is called the Easy BAA, as you've heard in other presentations this morning. This enables us to support transformative, innovative approaches that challenge assumptions, are outside the mainstream agenda and unmet needs, and have the potential to radically change established practices, lead to extraordinary outcomes, and create entirely new research and development fields. Although limited to projects under $750,000, there is newly authorized phase that allows potential follow-on awards up to $20 million. Another innovative collaborative tool is the RRPV, as mentioned in other presentations this morning, that stands for the Rapid Response Partnership Vehicle. We learned from COVID-19 response that we must have pre-existing acquisition vehicles so that we can rapidly establish relationships and execute awards appropriate to the response. The RRPV is a 10-year, multi-purpose acquisition vehicle. It is designed to facilitate research and development of future medical countermeasures from early stage development through advanced development, procurement, sustainment, commercialization, including manufacturing infrastructure development. BARDA is also, as mentioned earlier, leveraging its other transaction authority, known across the industry as OTAs, to establish the RRPV, which is designed to complement existing partnering mechanisms. The RRPV will play a vital role in equipping our team to meet the fast-paced requirements of the dynamic world in which we operate. RRPV will support advanced research and development across two distinct yet equally important focus areas: medical technology, known as MedTech, including diagnostics and vaccines and therapeutics, known as VXTX. RRPV is designed so that we have existing relationships that are critical with industry partners across their focus areas who are able and ready to respond quickly to new public health emergencies whenever it occurs. Lastly, TechWatch. TechWatch serves as our platform for stakeholders and private sector collaborators with promising medical countermeasure products or related technologies to request meetings with BARDA experts and other government entities. These meetings focus on sharing information. We gather insights into innovative concepts and products while providing feedback to help you prepare a stronger, more formal proposal. If during the meetings it becomes apparent that your product isn't yet suitable for BARDA's advanced research and development collaboration, our experts, who are best in class, can assist in identifying alternative funding and collaborating opportunities with interagency partners. We are excited about how we have streamlined these entry points and invite you to visit us at the Engagement Suite tomorrow. There also are opportunities throughout today and tomorrow to interact with our division leaders and other experts. We also have a session tomorrow on how to develop successful proposals, and there's a session with experts from our Drive division that will walk you through the Easy BAA process. All right. Now, Tim Belsky, Branch Chief for Biomedical Manufacturing Preparedness, will share more about Biopharmaceutical Manufacturing Preparedness Consortia, which is another way that we are leveraging what we've learned over the past year and streamlining how we prepare for the next health emergency. Tim will be followed by John Riggs, who will talk about how companies can utilize our TechWatch program and meet with us before developing and submitting a formal proposal. All right, video, please.
As we experienced during the COVID-19 pandemic, new vaccines and therapeutics can save more lives if they can be manufactured rapidly and in the quantities needed to meet the emergency at hand. I'm Tim Belsky, Chief of the Biopharmaceutical Manufacturing Preparedness, or BioMap, branch here at BARDA. The BioMap program's goal is to strengthen and enhance domestic manufacturing capabilities. One way we will achieve this is by enabling fast and flexible access to commercial biopharmaceutical manufacturing technologies that can transition rapidly to future public health emergencies. Producing vaccines and therapeutics is one of the most challenging aspects of responding to disease outbreaks and pandemics. With BioMap, we are meeting this challenge by partnering with the nation's leaders in the commercial biopharmaceutical manufacturing industry to leverage their ingenuity and technology in service of the country's needs. The BioMap program is proud to announce the recent establishment of the BioMap Consortium. The consortium is a new partnership mechanism that enables industry to work with BARDA in a streamlined fashion. The BioMap Consortium will focus on 3 domains. The first domain is expanding the industrial base of the supply chains that support biopharmaceutical manufacturing. Our ability to domestically produce the ingredients, raw materials, and supplies needed to make vaccines and therapeutics is a core strength that we must continue to build. The second domain is the expansion and reservation of drug substance and fill-finish manufacturing capacities. These capacities underscore our basic ability to produce the required vaccines and therapeutics and have them ready for delivery when and where they are needed. The third domain is development of advanced biomanufacturing technologies. New technologies drive our ability to deliver life-saving vaccines and therapeutics faster to more people. To ensure that the consortium runs smoothly and efficiently, BARDA has awarded an agreement to Advanced Technology International to serve as the consortium management firm. ATI will establish and manage the BioMap Consortium. ATI is here at BARDA Industry Day to answer questions you may have about joining the BioMap Consortium. Vaccine and therapeutics manufacturing is a team effort. BioMap works hand in hand with our colleagues across BARDA, ASPR, and NHHS, and with our industry partners to ensure that vaccines and therapeutic products will be there when and where they're needed during a public health emergency. The BioMap Consortium, along with our partnering mechanisms such as the Broad Agency Announcement and Rapid Response Partnering Vehicle, provides a comprehensive platform to support U.S. preparedness and rapid response requirements. For more information, please join me here tomorrow at 10 a.m. in the Declaration B room. The nation must be prepared to manufacture vaccines and therapeutics at the speed and scale required to respond to future pandemics or other public health emergencies. The BioMap Consortium is here to meet this challenge and looks forward to working with you.
I'm John Rigg, Director of Management Operations at BARDA. I'm here to give you a brief introduction to TechWatch. TechWatch gives you, our collaborators, an opportunity to meet with federal government experts before you are ready to submit a formal proposal. Many companies find that a TechWatch meeting provides invaluable information. The information you can get from a TechWatch meeting can help you decide whether to submit a proposal to BARDA or to another part of the government. And if you choose to submit a proposal, information you may get from a TechWatch meeting can help you make your submission more likely to succeed. Here's how TechWatch works. Through the TechWatch program, innovators from companies, academic institutions, and nonprofit organizations can meet with federal government scientific experts from BARDA as well as our partners across the U.S. government. Innovators present data related to potential medical countermeasures, technology platforms, or manufacturing capabilities that are relevant to BARDA's public health security mission. What's important is that TechWatch is a two-way exchange of information. You bring your latest information, data, details, and your knowledge of emerging technology tools and trends. And in exchange, our technical and strategic experts give you open and honest feedback to help you find ways to work with us. This may include such things as an opportunity to showcase technology to BARDA and a wider audience across the U.S. government, information about existing relevant funding opportunities, a roadmap on how organizations may interact and partner with the government, techniques and strategies for addressing technical and regulatory challenges, information on how to optimize a formal submission, such as a white paper, full proposal, or abstract. TechWatch meetings have two main goals: to help accelerate success and inform next steps for the organization's product development program, and to help clearly define how the technology aligns with BARDA's strategic mission priorities. TechWatch is an excellent place to start when you think you have a product or technology that can help protect the nation from future health emergencies. Our TechWatch team will be in the engagement suite, along with our other business development experts, so please stop by and ask any questions. You can also get more information from our website.
All right. We hope this gives you an idea of multiple ways that private sector collaborators can work with BARDA. Our success depends on supporting not only existing innovators, but growing the opportunity in the community of people who are and could develop products and technologies that can save lives. Our team members will be in the engagement suite tomorrow starting at 9 a.m. That's in the Burnham room. They'll be there from 9 a.m. until 11:30 a.m. and again from 1 to 5 p.m. Please stop by, get to know us, get to know the acquisition staff, get to know those in the program as well. Together, Americans, by driving innovation for preparedness and response, we work well with you as our collaborators. In addition, there are many other sessions that we've arranged to give you the opportunity to learn more about funding and collaboration opportunities, as well as our strategic priorities. Among these are a presentation by Shannon Jackson, the director of the HHS Office of Small Disadvantaged Business Utilization, first thing tomorrow at 8:30 a.m. Also, we have networking opportunities after our formal presentations in today and again tomorrow. We are here to answer your questions, learn about what you are working on, and find ways to collaborate so that we drive innovation for preparedness and response. Thank you.